y'all, JessicaRayPlays, and welcome back to the channel. And today I'm doing something completely different than what I normally do. Usually I'm all in my gaming videos and in the Sims videos and everything else. But today I wanted to kind of share like a life update with you guys regarding everything that's going on. Because I'm sure you guys have been seeing kind of like less and less of me, and you're probably like, where are you? What's going on? And if you're not on Discord, then you probably wouldn't know, because usually I tell Discord members, or if I'm live on Twitch, I'll discuss things there. So you probably have no idea anything about what's going on. So I'm going to go ahead and we'll do like a little range topic about everything, and I'll give you guys updates on everything that is going on. But if you are new to my channel, make sure you do hit the subscribe button, because it does just help our little village to grow. Make sure you give this video a big sweet thumbs up, and make sure you are sharing this video, because it does just help push me out to other people who may like me as well. So first things first, I guess I will talk about the elephant in the room, and that is my hair. I got it cut. Obviously, this is something that we're all gonna have to get used to. I haven't had my hair this short in like forever. I told them like here, like, you know, below like the boobs, you know, like the bra line, that's like where I wanted it, and for some reason she went way up here. So like, I mean, even like right here, look how much hair I could have had more of. Like, that's a lot. Like, it is just hair, and we will get through it, and it'll be perfectly fine. It will be there before we know it. At least I hope so. I got fall decorations out, already started, so it's really, really pretty. And it is still like, it's noon. It's lunchtime, but whenever nighttime comes, whenever I do like my actual like filmings, you kind of can see it back there. I got this whole brand new little system. It is like Starry Night, and it beach waves motion and everything. You can see it kind of like twinkling a little bit behind me. It is called the Spaceship Projection Lamp. I got it on Amazon. We can actually like fade it too, so maybe like it will change colors maybe a little bit. I don't know. Like, we'll just have to wait and see how it goes, but obviously that's new, so that is really, really fun and dandy. So if you don't know, I do work in healthcare. That is what I've been doing for the last 5 years. I am not a nurse. I'm going to go ahead and say that. I've never really told you guys what I do with my healthcare, but a bunch of you guys have a bunch of questions, and all of you are dying to know. But no, I am not a nurse. I am not making those big coup bucks or anything like that. So where I work, they actually mandated everybody to get the COVID vaccine at my job. If you don't get the COVID vaccine, you have to do weekly testings. And obviously, I am a procrastinator in life in general. So when it comes to those things, I've been putting it off. And then my mind goes to the worst case scenarios. It literally thinks like, well, this hasn't been out that long. It literally has been out, what, 6, 7, 8 months, this vaccine, and it literally took them a year to make. How safe is this? We don't know what this vaccine is going to do to us like 5, 10, 15 years down the road. You know, obviously just overthinking like I typically do, so I just always prolonged it. And then September the 2nd, when I was working, I actually just got up, said, hey guys, I'm going to go get my vaccine. So I went ahead and got my vaccine, my first shot that day. Perfect. Arm was a little sore. It kind of feels like if you got your tetanus shot. For me, that's what it felt like. It was just really sore. I just rubbed it like all the time. That was the worst thing that I had. No big brainer. So I had to wait 2 weeks in order to get my second dose of the COVID vaccine, and I did get Pfizer, which was the only one, if I ever did get one, that was the one I was going to get. All the rest of them, I was like, nope, I don't want that. I want Pfizer. So I literally think it was like the 23rd, I think I went and got the second dose, which I was really expecting to have like the flu-like symptoms, body aches, you know, whatever. That was what I was expecting to have, but it was actually really, really good. It was a piece of cake, and it was probably the easiest one I have. Again, the arm just got really, 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 really sensitive, really sore. Again, I rubbed it, and we are 4 days from that, and we are going tough, and we are going strong. Unfortunately, since I did prolong that inevitable and procrastinate a lot in my life, we now have it where if you're unvaccinated, you have to get weekly testings done at my work to show that you are COVID free. So I have to wait 14 days, because that's how long it goes into, well, 10 to 14 days, let me be precise, in order for you to have like the full immunity, full whatever register of the COVID vaccine. So I had to wait till like October 7th or something crazy like that in order for me not to have it. So this week and next week I have to go for a weekly testing and get COVID tested, and actually I'm going today at 5:50, so I got like 5 hours. I am so nervous, so freaking nervous, because I hate it when you even have the flu or you have anything like that and they go up your nose like that. That hurts. I can imagine what it's going to be like for that. So I'm dreading that already. My work is also, we have over 50% of our workers at my job is travelers. So with traveling nursing, it's basically exactly what it sounds like. The nurses come from anywhere and everywhere, and I forget how, I think it's like 50 or 80 or 100 miles. I don't know. I can't even remember what it is now. Like, it has to be like a really good distance from like your home place. And they got a contract for 6, 8, however long their contract is. And once that contract is up, they can either renew with us or they can go on somewhere else. So a bunch of our traveling nurses are actually leaving because they're going to go where the money's at, which is most likely the COVID places like New York and everywhere else, or whoever it is, I don't even know. So we had a bunch of people leave. So right now we are really understaffed, like crazy amount of understaffing. So in order for them to compensate that loss of having the travel nurses leave, they have actually brought up a lot of surge pay. So surge pay is anything that is over what we're supposed to work. So I am PRN. I have to work 36 hours in a month. And then obviously full-time members, it is 36 hours in a week. So if you work 40 hours, let's say, then you get 4 hours of surge time. So anything over my 36 hours in a given month, that is surge pay for me. And surge pay has gone up tremendous. It is crazy. I think surge pay for me was like $4, and they've upped it to $12, and I think there's a new one coming out here soon. It just shows you how short we are. Surge pay for me would be like $20 an hour, which is ridiculous. And that's on top of like what I already make. That's on top of shift diff. That's on top of everything. So that's extra money that's being thrown at me. So obviously with Christmas coming up, that is something that I have been diving into. And I'm not going to lie to you guys. I'm going to be 100% with you guys because I'm sure some of you have some questions about YouTube. How much money do they make? Do they bankroll you guys? I'm sure it's like a lot of money. No. This is solely just for me. It's for me. I've always wanted to do this. I've always wanted to be a YouTuber. I've always wanted to have fun and sit here and talk to you guys. So when COVID started, I was actually doing pretty good per month. I was making like $20, sometimes $25 a month. Guys, $25 a month for my YouTube channel. And now that everything is like opening back up again, everything is like, you know, everybody's getting back into their normal lives. Obviously views have went down, and maybe even just because I haven't done a lot here recently either. Right now I'm receiving like $15 to $16 a month. And also YouTube has it where they have a $100 threshold. So you have to go over that $100 threshold in order for them to pay you out. So that does stink, but it's just like Twitch. If you go to Twitch, they have a $100 threshold as well in order for them to send it to you. So that is another thing that is a little bit more crazy and everything else. But if you guys have any questions about YouTube or my work or anything like that, definitely let me know and I'll go ahead and tell you guys more about them in the comment section, because I know that was a lot to, you know, digest in a little bit of time. And that brings me to my last topic that I'm going to kind of go over, and that is my family and everything that's been going on with it. There has just been a lot with my family here lately and with my household and everything else. So we actually had our refrigerator completely die on us. Like, it gave us like a 2-day notice and it was out, and we literally went and got groceries maybe 4 days before it went out. So we had a lot of money that we just lost out on because of a refrigerator, and so we had to get that expedited and bring it back into us and everything. And that was, you know, that's how it goes, I guess, owning your place. Like, it's no longer up to the renter people to fix things. It's up to you. So it was a headache, and it was aggravating and everything else. Like, I had things in there like stored, like the kids medicine and everything that just had to be thrown away. It was hard. And I know me saying hard to handle, a bunch of people are gonna be like, what? Like, your refrigerator died, you got a new one, whatever. But it was literally like the straw that broke the camel's back. Just everything that's going on with work and everything that's going on here and there, and just obviously things that I can't talk about. And then my kids are going back to school, which is great for me, but it's also a scary thing to be like, oh my gosh, you know, this is this Delta variant is still out there, like what happens if they get it. You know, just all these possibilities have run through my head as well. But one thing that they don't teach you on them, one thing that is obviously going to happen is these kids have been out of school for a year, and now they are thrown back into society, and going back into school is hard, at least for my kids. The anxiety for my children have really kicked in. My little one and my big one, they do not want to go to school. They are dreading it. They just much rather be home. And I've never fully told you guys about my second child, which is Noah. Mostly because I was waiting for my Dream House series, my Life Leading to the Dream House or whatever it's called. I can't even remember now. I think it's been like a year since I've done that one. So when he was 6 months old, I noticed there was a big difference between how he was developing and how my daughter developed. I know girls develop faster than boys, but this had nothing to do with that. When it came to touching the grass, he hated it. He would cry, he would scream, he would do whatever he wanted to. It was different textures he couldn't stand. It was even like eating wise, it was different textures that he could not do. And then when it comes to those milestones that you hit, like crawling, sitting up, walking, everything was delayed. It actually took him until he was 9 months in order to sit up unassisted. And I repeatedly worked with him every day, multiple times a day, to sit up. And even the doctor said if he didn't hit that milestone when he did, they would have like done something else. So of course, when you tell your doctor something like, hey, I know my kid's different, I know my kid needs something, like I needed to get him into First Steps, which is something that Kentucky has in order to help kids get further, they denied me. They said that he was fine, he was just a little bit delayed, you know, whatever. So finally, I think when he was 12 months old, they finally listened to me and we got him into First Steps. Go figure. And later on, we had to go to another really big children's hospital, and they diagnosed him with global developmental delay. It just means like you're delayed in every area possible. I've always thought he had a little bit of touch of autism or being autistic. And we did that testing when he was 5 years old, and they came back and said no. We've been trying to get that testing done every year because I definitely feel like that is something that he has. He doesn't look at you straight in the eyes. When he does look at you, like he's looking at your chin, or he's looking at your lips, or he's looking like, you know, like right here, like at your shoulders. He never looks at you in the eye. And he's still very much like that texturized person. He does not like eating certain things. And there's just a long list of everything like I could tell you guys, but long story short, it has been a very much of a process with him. They won't give us that diagnosis. They say that he's too social, which I don't know how you can determine that with a kid that you literally spend 5 minutes with. But hey, I'm not a doctor. And also, I've told them many, many times that he is very much more social with adults than he is like kids his age. He still does that, you know, side by side playing, and he still kind of likes to play by himself. He has no interest in talking to other kids and everything else. So it has been just the longest time to try to get him official diagnosis. I think last year they gave him a diagnosis of ADHD, which whatever, if you wanted to do that, that's fine. However, last year they did put him on some impulse medicine, and it is geared mostly for autistic children. So that was actually kind of interesting that they would put him on that certain medication, which I know it's just for impulses. That's the reason why they put it on him. But we can't get that diagnosis of autism. So if you are a parent or a mother or a father or a caregiver of somebody that you are trying so hard to battle to get them a certain diagnosis or to even get a diagnosis, then you completely understand what I'm talking about when I say that I am just exhausted. I am exhausted mentally, physically, just everything. And there's days that I want to film for you guys, and then there's other days where I'm just like, I don't feel like putting on makeup. And I know I could probably film a video for you guys without makeup and you guys would not care, but it's my channel and I want to be presentable for you guys, and it's just been really, really hard to get motivated because of everything that's going on, work, life, general, just everything like that. And like, it's crazy to say, but in a sense, I've kind of gotten, I don't know, just unmotivated, I guess, in general, or just like, oh, I don't want to play The Sims anymore. You know, I've been playing it for 2 years now, and I'm just like, oh, I don't, I don't want to do this. I don't want to do this anymore. But I do want to play it, but I don't know. It's been a battle within myself. And I really do apologize for you guys for that as well. There is a new game that I'm going to be getting here soon, and it is The Strange Life, or Life is Strange, or whatever it's called. I don't know. Carr told me to get it. He's one of my subscribers that's on here, and he told me to get it and play it. So I will be getting that here shortly, and I'll be playing it, hopefully. I haven't decided if I'm going to play it on Twitch or if I'm going to play it on YouTube. So if you guys definitely have some recommendations on where you would like to see me play, definitely let me know in the comment section down below. But I definitely wanted to get on here and just kind of give you guys like a life update in general about everything. And so if you guys have any questions, just leave them in the comment section down below and I will answer you guys. But I wanted to update you guys on everything just so that you guys know and you can understand a little bit about where I'm coming from and like what's going on with my life and in general and everything else. But I do love you guys so stinking much, and I'm not going to give up on YouTube. Not yet. Like, I'm still going strong. Like, it's going to be here. It might take me a little bit of time to get back into it, but I'm here. I am present, and I'm just kind of going through my own crap right now, mentally, physically, emotionally, like everything. But I promise I'll get back in the swing of things, and you guys will see me so much. And obviously with the kids being back at school, hopefully I'll be able to do more lives during the daytime. Once I kind of get back into my routine, we will do that some more. And I can't wait to get back in there and talk to you guys because that's literally why I love doing this. I love talking to you guys, and it's literally like the highlight of it. Is just connecting with you guys, talking with you guys, asking you guys, what did you eat? What have you had to drink? And about your days. And obviously we get people in from time to time that likes to come in and they're having a rough day too, and that's the reason why I did this, is just to make people smile, to make people laugh, and to make people just feel special and appreciated, and that they are a human sometimes, because we all kind of forget that, I think. But yeah, I'm going to go ahead and wrap that up right here because I am done ranting. It is, like I said, it is at the 25 minutes that I have been jibber-jabbering, and I think you guys are done with me. So I'm going to go ahead and end this off right here, and I hope you guys are having an amazing day, and I love you guys so stinking much, and I'll see you real soon in my next video. Alright guys, love you. Bye. Mwah. Bye friends.